Andy Young at St. John's, and we're just going to talk a little bit about one of the key aspects of knee replacement, just getting your motion back. And Albert has been kind enough to talk about his experience, specifically about manipulation. So, about 1 in 100 need a manipulation. They do the therapy, they do all the work, but they still need extra help getting their motion back. So I was hoping that we could talk a little bit about what your experience was after your knee replacement and get your motion, and then we'll go on how we made the decision to manipulate. So
You want me to start now?
Yeah, go ahead.
Okay. So basically, my range of motion was very limited. And after going to physical therapy, I think for a month, because we did surgery in November, we went through January, and then we weren't making any progress. So the suggestion was to do a manipulation. And not too many people who I have spoken to who had knee replacement surgery had done manipulation. So they said, what's that about? And then understanding that 1% of the population needs this, I said, okay, let's do it. My wife was really scared because the recovery from surgery was a pain in the neck. It wasn't very popular to sit in bed all the time. She said, oh my God, you're going to be down again for another month or two or something. And when I was told that that wasn't the case, but it may be, because everybody works at a different rate, I said, you know what, I'm not making progress with the physical therapy, and I believe we've got to do something. And I was outcome driven, not process driven. I knew I had a process to go through to get the desired outcome. And since I was outcome driven, I said, let's go for it, understanding that if I had another month of pain, that's okay, because at the end of that period, hopefully it would be done. But it's a scary thing, and part of the scariness is, gee, you gotta go back to the hospital, you gotta go into an operating room or to a room, and you gotta take anesthesia. And people say, oh, I go to a hospital, I get an infection, so I don't wanna go to a hospital, get an infection, right? Every hospital has infections. Yeah. And anesthesia, why? It must be really painful to have anesthesia. But again, my history of being ill said to me, hey, let's go get the right outcome. So if you're outcome driven, then it's a procedure that I would recommend.
Right.
If you're scared and you're in pain all the time and you don't want a good outcome, you don't mind being on a cane or crutches and going to the supermarket on a cane, then don't do it. But if you want to I play golf, so if I want to play golf, I knew I had to do it. And that was my outcome driver. I also sail a little bit, so I go sailing, which is nice.
Yeah.
And I want to be able to walk around the boat. And so that was the driver for me to go for it, and understanding there might be some pain, but again, I'd be able to play golf, go sailing, walk down the block without a cane. And when you go to the supermarket, you don't have to be in those electric carts.
Right.
So that's the motivation.
Let's go back to the last winter, right, when you were in the winter of this season.
Yeah.
Because we were seeing each other every 3 weeks. We were
Right.
trying, you were pushing, you kept saying, I'm trying.
Yeah.
But we just weren't making any progress. Just what was going through your mind when you were trying but not making progress? So you were seeing everybody else in therapy making progress, but you weren't making. What were you thinking?
Gee, did he put the wrong parts in?
Okay.
Did he put in like a part for a Chevrolet,
Yeah.
on a Cadillac or something? And once he determined that the parts were fitting properly and that the mechanical part was okay, then and we discussed that it was a tendon or soft tissue problem and how we're going to attack the tendon or soft tissue, then this was the next approach. And so I think if you break it down into the parts are working well and it's a soft tissue issue, let's work on that issue.
Great. And because as soon as that we had you relaxed, we were able to help you get from 85 to 120.
Yeah.
What's your motion now?
I don't know, what is it?
Yeah.
It's
It's about 130.
Yeah.
It bends really nicely.
Yeah.
Tell us about the first week or two after the manipulation.
don't remember it that well.
Yeah.
I thought it was painful. If I remember correctly, I thought it was painful. But it's been 9 months or 8 months, 8 months since
So
I did
you don't
it.
even remember.
I don't remember.
Okay.
But it was step 2 to fix the problem.
We needed a nudge.
Exactly.
Yeah.
Yeah.
So for patients out there who are really trying, they're trying, tears are coming to their eyes, they're sweating, they're trying to get their emotion, but they're just struggling and they feel like they're getting nowhere. What would you tell them?
Tell me what you want to do with your life after, so what your objectives are. If you're willing to walk around with a cane and crutches for the rest of your life, and that's okay, that's one of your decisions. But if you want an outcome that's different, then you want to give it a shot. And you know, I've always been in the top 1%, right? So I was in the top 1%.
Yeah.
And this, I would say, this stuff happens. Life, you can't predict life. You cannot predict. You know, stuff happens.
Right.
And if I'm in the 1%, I wish I was in the 1% tax bracket, but I'm not there yet.
Yeah. So we just keep working on it
Yeah.
to get the outcome
Exactly.
that we want to
It's
see.
outcome
We
driven.
just keep, and we just keep working. We keep making adjustments. We keep fine tuning. And
Yeah.
I think your commitment, because even though your wife was afraid, and even though there was some concern, you did beautifully. Okay, good. Well, thanks so much for sharing that.
You're welcome. Good luck.